We've got a very special guest coming up, Dr. Brad Weeks. I've spoken with him before at a conference, The Right to Try. Great guy, lover of liberty. He completed his undergraduate studies at Dartmouth College then, prior to medical school training at the University of Vermont. Dr. Weeks worked in the Harvard system doing 2 years of research at Was he in General Hospital? Were you in General Hospital? Not the soap opera.
MGH, Man's Greatest Hospital.
Man's Greatest Hospital, Massachusetts General, and a mineral metabolism unit working on osteoporosis. In addition, he studied nutrition, acupuncture, massage, shiatsu, music therapy, anthroposophical medicine, and classical homeopathy. A charter and founding member of International Organization of Integrative Cancer Physicians, he is one of 3 doctors in the USA who is certified to teach insulin potentiation chemotherapy, IPT, to medical doctors. He's a pioneer in oncoimmunology. He has lectured over the past 5 years about the revolution in oncology, teaching that cancer stem cells should be the target for treatment and not the relatively harmless cancer tumor cells. Brad told me just before a year ago he founded the Washington Integrative Medical Association. Those of you who love health freedom, let me hear you. Health freedom, anybody? This is the guy for patients and doctors. Please welcome Dr. Weeks to the stage. Dr. Brad Weeks.
You are such a pro. I love it. Thank you all. What a pleasure. Thank you. Thank you. It's a great honor to be here. And I have to apologize right off the bat because it's always quality or quantity. And I'm going to give you quantity today. I hope some quality slips in, but we're going to go through a lot of information. So for all of those who are watching this online, 500,000 people, pause for the slides to go to the references, because my goal is to give you the science which will empower you to know that what I'm telling you is true. I don't want to try to persuade you about each point as we go along. I want to just, in a way, inform you, and then you can do your own due diligence.
Well, inflammation is all people are talking about in the news nowadays. All chronic major degenerative illnesses hurt you by way of inflammation. And if you can cut down chronic inflammation, you're going to cut down the suffering from most every major illness. For example, although I was taught 25 years ago that inflammation always resulted in pain, so if you had a sore ankle or a sore knee, you had inflammation there, it is the case, ladies and gentlemen, that if you're listening to this webinar and have no pain at all, you are still most likely suffering from inflammation, because we now know that not only is obesity related to chronic inflammation, but also chronic cellular aging, the march of time, is an inflammatory process, which if you address with effective, safe anti-inflammatory agents, you're in a situation where you're going to slow down aging. Now, arthritis, of course, is inflammatory, but we can go even more particular to the cytokines, which are released in an inflammatory process, which are the destroyers of your cartilage and your joints. Cardiovascular disease, the heart disease, the stroke, and the heart attack, that begins with an inflammatory process, and it kills through inflammation. It leads to the calcification and the blockage. Most importantly, cancer itself is not dangerous unless it metastasizes. Many people, upon death from a heart attack or something, are found to have had cancers. When I was working in the as a diener in the wards of Beth Israel Hospital in Boston, we typically would find people upon autopsy who had cancer and they never knew it. So the problem is, if they had a lot of inflammation, it would have metastasized. So the lady who has had a breast taken off and the doctor says, don't worry, you're cured of cancer, she had better be paying attention to her inflammation markers, because if the breast is off with the cancer but there's still cancer stem cells around and she has inflammation in her life, they will spread. So if you want to stop cancer metastasis, you need powerful anti-inflammatories. Finally, I mentioned stem cells. It's a very interesting development in oncology today. Stanford just received $90 million to study this in a grant. The cancer metastasis is an inflammatory process, but also the recruitment of healthy stem cells to become dangerous cancer stem cells works through an inflammatory process. Lastly, schizophrenia and psychosis. These are considered significantly inflammatory processes. So diabetes, etc., no matter what's going on inside you, you will be healthier if you can tone down the inflammation. And as you know, most of the drugs on the market just deal with one component of the whole inflammatory cascade, and they have typically very, very serious side effects. Aspirin will make your gut bleed and you'll die from loss of blood. A lot of the COX inhibitors have been taken off the market for all sorts of reasons. So to do anti-inflammation safely and effectively has been an elusive goal of the pharmaceutical companies. We have that benefit with these. Here's an article published in 2010, comes out of Harvard, and they basically are saying that if you want to interfere with inflammation, that's the new strategy to block breast cancer, self-renewal, and progression. Self-renewal and progression is a way of saying metastases. Ladies and gentlemen, if people you know and love have cancer, they need infertility. I'm going to show you different examples of how inflammation can hurt you. Women suffering from asthma, another inflammatory process, are more likely to have difficulty becoming pregnant because there's inadequate circulation to the womb based on inflammatory problems. Very interesting little piece there. How about asthma again? 10% of American children now and 235 million people worldwide are suffering from asthma. Asthma is a very easy disease to treat. You fix the food to get the anti-inflammatory foods in the diet and the pro-inflammatory foods out of the diet, and then this is astonishing. Now, Alzheimer's. All of us are paying attention to Alzheimer's, of course. Alzheimer's is an inflammatory disease. If you know people who are suffering from memory disorder, what we know is that anti-inflammatory approaches that may not cure Alzheimer's disease will likely help slow the progression or the development of this devastating disorder. If you didn't know that Alzheimer's was an inflammatory disease, that's important information. Here's another piece of the information. It shows that the additional studies link the COX-2, that's a cyclooxygenase enzyme, to the loss of brain cells. So also Parkinson's disease, folks, and Lou Gehrig's disease require anti-inflammatory efforts. All right, now, diabetes and obesity, there's a new term, diabesity. They're really related. It's an autoimmune inflammatory disorder, and inflammation may be the single most important mechanism driving this diabetic obesity epidemic. Okay, now let's talk about humor for a minute.
Chronic inflammation actually is a low-grade systemic inflammation, and it often fuels a lot of diseases. Cancer, diabetes, heart disease, even your autoimmune diseases have been linked to inflammation. Some of the causes of this chronic inflammation we're talking about are your environment, the pollutants in your environment, lack of sleep, stress, smoking, obesity. Symptoms of chronic inflammation, actually the big red flag is when you get the disease. When you are eating a basic American or Western diet, what happens is our body gets taxed with all the extra fats and sugars and processed foods that we eat. So yes, we do get some nutrients, we get some vitamins, we get minerals out of our food, but all those excess fats and oils and sugars, it basically taxes our immune system. It's making our body work in overdrive all the time. And when our body's trying to work in overdrive, it's that inflammation, that chronic, slow-growing inflammation that in the long run is going to be causing some of these diseases. For inflammation particularly, or anti-inflammatory foods, you want to think red. Your berries, your cherries, cabbages, your red onions, your red apples. You really want to think of red because they have something in it called quercetin, which is very important to fight inflammation. There is a lot of power in your kitchen when you're talking about anti-inflammatory foods. One of the big ones is your turmeric. Turmeric is a yellow Indian spice, and it's very powerful in fighting inflammation. You also can use a lot of your herbs and spices. If you think about it, if you use a lot of herbs and spices, you'll actually be cutting down on the fats and the oils in your food, and you'll be getting a lot of your chlorophyll from it, as well as other anti-inflammatory properties. Thyme, oregano, basil, and parsley are some of your big ones. Number one, sleep. Make sure you're sleeping. Number two, get exercise. Make sure that you're moving daily. Number three is reduce stress. We all have stress in our life, but it's important to keep it controlled and maintained. And number four is to eat an anti-inflammatory diet. Anti-inflammatory foods are colorful foods. I always say eat from the rainbow, and that's so important when you're trying to reduce inflammation.